For decades, if you were diagnosed with something called neovascular age-related macular degeneration, or NAMD, it was pretty much a one-way ticket to losing your vision. But over the last 20 years or so, this incredible scientific quest has completely flipped that script. So today, we're going to trace the evolution of a treatment that has literally saved the sight of millions.
But here's the thing. That quest came with this absolutely massive challenge. I mean, just think about this for a second. How do you ask someone to get an injection directly into their eye, not just once, but maybe every single month for the rest of their life? That's the unbelievable treatment burden we're diving into.
All right, so the first big step forward was, well, it was nothing short of a miracle, really. Scientists figured out that this one protein, called VEGF, was the culprit. It was basically telling blood vessels in the back of the eye to get super leaky, and that's what caused all the damage. The solution? Seems simple enough, just block it. And just like that, the anti-VEGF revolution was born.
And this chart right here, it shows you that miracle in action. Just look at that black line. In the very first year, patients were gaining, on average, 9 letters of vision on an eye chart. 9 letters! For the first time in history, we weren't just stopping vision loss from AMD, we were actually reversing it. It was a total game changer.
But, and this is a big but. Here's the catch. Follow that same black line out over 5 years. What do you see? All those amazing gains, they just vanished. In fact, on average, patients ended up with worse vision than when they even started the treatment. The data told this really harsh story. That grueling schedule of monthly injections just wasn't sustainable in the real world. People were getting undertreated, and as a result, they were losing their sight all over again. Okay, so the next chapter in this story was all about fixing that 5-year drop-off. A new drug came along, called Aflibercept, and it was engineered to be a more powerful, longer-lasting blocker of that leaky VEGF signal. And wow, this slide just perfectly illustrates its success. See the green line? Aflibercept totally cracked the code. Those critical letters of vision that were gained in that first year were now held steady over the full 5 years. This was a huge step forward in preserving people's sight long-term. But that core problem for patients and for doctors, it didn't really go away, did it? The treatment burden was still incredibly high. Sure, injections were now maybe every 8 weeks instead of every 4, but that's still 6 trips to the clinic a year, every single year. The need for something even more durable, something that lasted longer, was staring everyone in the face.
So, of course, the search for that durability continued. The next drug to come onto the scene was Brolucizumab. This was a smaller, more concentrated molecule that really promised to last even longer, offering this tantalizing glimpse of a future with way fewer injections. And let me tell you, it was powerful stuff. Take a look at this data. What you're seeing is that Brolucizumab was way better at drawing the retina. At the 1-year mark, way fewer patients on Brolucizumab had that damaging fluid in their eye compared to Aflibercept. This was a really good sign that, hey, maybe this is the more durable option we've been looking for.
But that power came with a very serious trade-off. After the drug was launched, reports started coming in about a major risk of something called intraocular inflammation, or IOI. This is a severe, potentially vision-threatening side effect. And that new safety scare just really put a damper on all the excitement and made it clear that just being powerful wasn't the whole answer. So this led researchers to ask a much deeper question. They started thinking, wait a minute, what if we've only been solving half the problem this whole time? What if just blocking the leak signal isn't enough? It was time to look at the other missing piece of the puzzle, the stability of the blood vessels themselves. So let's quickly break this down. For years, the main bad guy was VEGF-A. The easiest way to think of it is as the leak signal. It's the protein that runs around telling blood vessels, hey, open up, become permeable, spill fluid everywhere. And yeah, every treatment up to this point was designed to block this one signal. But then, scientists discovered there was a second key player in this whole mess, a protein called angiopoietin-2, or ANG2 for short. Now, if VEGF-A is the leak signal, think of ANG2 as the instability signal. Its job is to make the blood vessels weak and fragile in the first place, kind of loosening all the joints so they're just primed and ready to leak the second VEGF-A shows up. So here's the crucial point. To really get this disease under control for the long haul, you can't just keep blocking the leak. That's like constantly mopping up a flooded bathroom. You also have to fix the faulty plumbing that's causing the flood. You have to address the instability. You've got to target both pathways. And that finally brings us to the latest innovation.
A treatment that was designed from the very beginning to be a dual-action solution, to go after both of these pathways at the exact same time. So let's take a look at how this totally new approach works. Meet Faricimab. This is the very first bispecific antibody ever created just for the eye. It's one single molecule, but it's brilliantly engineered, almost like a Swiss Army knife. It has two distinct arms. One arm reaches out and grabs that leak signal, VEGF-A, and shuts it down. At the same time, the other arm is grabbing the instability signal, Ang2, and neutralizing it too.
Okay, so let's go back to our big chart one last time. See that purple line? That's Faricimab, and you can see it achieves those same fantastic sustained vision gains that we saw with Aflibercept. But, and this is key, by addressing both biological pathways, it does something more.
It delivers a level of durability that we've just never seen before. For the first time, patients who are eligible could potentially go up to 16 weeks. That is a full 4 months between their treatments. This isn't just a step forward, it's a revolutionary leap in reducing that awful treatment burden.
And the data from the clinical trials is it's incredible. In these two big studies, Tenaya and Lucerne, after 2 years of treatment, nearly 80%, that's 8 out of 10 patients on Faricimab, were able to go 12 weeks or even longer between their eye injections. 3 months or more.
And you don't have to take my word for it. This quote from the study publication really says it all. By targeting both Ang2 and VEGF-A, Faricimab has the potential to really stretch out that time between treatments without giving up an inch on those hard-won vision gains that patients absolutely need to preserve.
So think about the journey we've just been on. We went from just trying to slow vision loss to reversing it, then to sustaining those gains, and now, finally, to dramatically cutting down the burden of the treatment itself. It just begs the question, right? With these huge challenges finally being met, what's the next great frontier for preserving our sight?